Hello. All right, it is 5 o'clock on this Friday. I've gotten through another, at least, work week, which means we are one step closer to defeating COVID-19. Let's start the way we always start, by remembering that we're going to get through this, and we're going to get through it together. Say it with me. We're going to get through this. We're going to get through this together. One last time. We're going to get through this. We're going to get through this together. We're going to get through this together because we know the rules, the things we've got to do, the behavior that we've got to model to make sure that we can keep our cases down, to protect those that are the most vulnerable, and to make sure that we are able to transition from healthy at home to healthy at work without causing a spike in cases. Now, these, of course, are our 10 steps of being healthy at home. Let's also look at the steps for healthy at work. Just wanted to talk for a minute about this piece, which is face-to-face meetings. Remember that just because we are back at work doesn't mean that we shouldn't, even if we are in the same building, use all of the digital tools that we have. Remember, the chance for COVID-19 to spread depends on density, depends on duration, amount of time that you're there. And so those face-to-face meetings, sometimes they're necessary, a lot of times they're not. So again, just think through all of your practices at work, at home, and otherwise. Remember, we really only have one shot to do this. We only have one shot to successfully reopen our economy during a worldwide health pandemic. So if the approach is business as usual, what it was before this, it won't work. So let's make sure we're committed. Let's make sure we're thinking through all of the different ways to do this right. And if you can go back to the 10 steps for healthy at home, I also just want to remind folks that we're excited that now, starting this next Friday, 1 week from today, we're going to be able to have gatherings of 10 people or less. Doesn't change these rules. Now, a gathering of 10 or less, if done incorrectly, can be dangerous. If done correctly, we can get a little more social interaction, and we can do it safely. So just remember that social distancing is going to be just as important when you can get back together with folks. Let's make sure that we prove that we can do this responsibly. Let's make sure that we continue making Kentucky, I believe, a model for the nation, that not only how we responded, how we flattened our curve, but also how we reopen our economy. So remember, when you're thinking out, and I know everybody's making plans. I mean, it's been so long. It's only natural to be making plans. But let's also think through and plan when you have people over, again, 10 or less, how you do it and how you do it safely. We always talk about these 10 rules plus one. Fill out your census. We right now are in one of the best places that we've been in recent memory at filling out our census. Let's not fall backwards. We realize that we're going to have an opportunity here, and we might as well view it as an opportunity to rebuild our economy, mold it in a way that not only responds to national security and the problems that we have seen in responding to COVID-19, not having enough in the right types of manufacturing, not having the labs that have now been built up here in Kentucky, the challenges to our food chain supply, the ability to rebuild our economy in a way that's going to be more resilient moving into the future, which we have the chance to do right now. In large part, it's going to be based on also the federal dollars that flow in based on the census. So if you're ready to reopen, you're ready to rebuild, how strong we'll be in the future in part will depend on whether or not you filled out your census. It just takes a couple of minutes. So please do it. I want to move up from 13th. I want to do better than that. I want to make sure that people notice that Kentucky not only can deal with an international health pandemic, but we're poised, we're ready, we're unified, we're going to do great things moving into the future. In addition to this, we've asked people to make sure, especially now that we're going to have more contacts out there, that we show people through social media and other means that we are doing it right. We project some joy out of doing the right things, following the right restrictions in a way that will help us be healthy at work. All right, so this is one of those times where that in-person meeting was necessary, but look at the way they're doing it in Nolan RECC. Everybody in here has a mask, even though they're 6 feet apart, right? Even though they spread out the tables. They have social distancing. They're wearing that mask because they know that the best shot they've got to stay open and the economy has to stay open is just to do it right. It works for everybody. It protects everybody. It gives us the best chance to get closer to a new normal or even the old normal if we just follow a couple of new rules. Yeah, so this is Greenhouse 17, an amazing organization serving folks who need it at the time they need it the most. But again, this is their staff showing off that they're willing to do what it takes to make sure that they are not only protecting those that they're serving in their time of need, but they are protecting one another. All right, this is an individual at TJ Sampson who was in the COVID unit for nearly 2 weeks. He is recovered. He's going to be in a rehab facility, headed home. This is one of those amazing stories and amazing results that we want to continue celebrating. Yeah, this is the fire department in Ellesmere, lighting up green, making sure that we remember that we are compassionate, that we are there for those that we've lost and their families, and that we know that there is a better day ahead, the color of renewal. Well, there's one more picture I think they gave you. All right. Today was my son's graduation from elementary school, and I know a lot of people are going through this. So today, we did this differently, just like so many other people are. He had a drive-through parade with his teachers where he was able to see them, and I got to tell you, he had a big smile on his face. I know it's not the way it was planned. I know it's different for so many, but I want to thank everybody who helped put it on for making my son feel very, very special, and I think we have opportunities to do that for so many that are out there. And I tell you what, this is one he will never forget. I can't remember. Well, I think we went through 6th grade when I was in elementary school. I can't remember that graduation, but I bet nobody forgets this one. So happy graduation, Will. I'm very, very proud of you. I love you so much. All right, so today we're going to learn in our sign language lessons, Happy Friday. All right, Happy Friday. One more time. Happy Friday. And it's a happy Friday for a lot of people in this room and out there because this is going to be the first weekend that we don't have a press conference on either Saturday or Sunday. I know there's people out there that have fatigue. We're still going to get you the information you need. We're going to release the numbers by a short video tomorrow, and then I will do Sunday and Monday's numbers together on Monday along with the updates that we have. We won't have any major updates other than reporting Saturday's numbers. You know, our epidemiologists, our state workers, they have worked so hard with very little break, as have so many others. I want to make sure that they're strong and that they're ready for the long haul, that they know that they are appreciated. But we will be back on Monday to answer any questions and provide any updates. All right, let's start today with a couple of news on some reopenings, which is tourism. So as part of Healthy at Work, the Tourism, Arts, and Heritage Cabinet will reopen tourism in an effort to generate revenue to boost the state's economy and offer Kentuckians opportunities to explore the Commonwealth through in-state travel this summer. Kentucky State Resort Parks Recreational parks, lodges, and cabins will be open to the public for normal business beginning June 1st. That normal business is going to be a new normal business. It's going to be required social distancing at each of these. The way the restaurants work will be different, but they will be reopened on June the 1st. Natural Bridge and Cumberland Falls State Resort Parks will also reopen on June the 1st. Park guests will be required to follow social distancing and public health guidelines. Guests can begin making reservations beginning Tuesday, May 19th at parks.ky.gov. Now, as part of our ongoing efforts, though, against COVID-19, the following state parks have been designated to help us provide temporary housing for low acuity patients, people who are sick but don't need to be in the hospital. So the parks that won't open at this time are Lake Cumberland State Resort Park, Lake Barkley State Resort Park, Blue Licks Battlefield State Resort Park, and Buckhorn Lake State Resort Park. Those are ones that are being used in our ongoing battle right now. And also, just as an update, Barren River Lake State Resort Park is currently closed due to renovations. Separately, the Kentucky Horse Park, Otter Creek, and State Park campgrounds will open on June 11th to self-contained campers and RVs in accordance to the Healthy at Work camping guidelines. Now, we originally didn't want to have to shut down campgrounds, but we had to do it because people were refusing to social distance. Now, just because we're reopening, just because we can have groups of 10 or less, doesn't mean social distancing isn't required. So let's not mess up a good thing. Let's make sure that we do this in the way that we've been doing everything else, which is responsibly. And I know we can trust Kentuckians to do it responsibly. All right, a lot of people have called on this one. Fishing tournaments may resume June 1st with new guidelines. June 1st gives time for Fish and Wildlife, which put in a lot of time and a lot of thought and have some really good plans. Everything from how you stagger the start to the virtual awards at the end on how to do this. They put in a lot of time, and I believe that as long as they can implement all of that, that it can be done safely. And separately, the Salado Wildlife Education Center will be open with limited capacity beginning on June 1st. Interactive exhibits, though, will be closed. So obviously tourism is an incredibly important business in Kentucky. We're taking a big revenue hit from it, but that's not the reason that we're reopening it now. It's that we believe we can do it safely with social distancing as long as Kentuckians continue to buy into the rules, to know that this virus is still out there. Then we've got an opportunity, especially this summer, for people to travel in-state where it's safest and in a way where you can still have that summer vacation with your family, though it will certainly be a little bit different. Separately, in tourism, we have new CARES Act funding. So we'd recently announced 93 arts organizations throughout Kentucky would receive $450,000. Today, I'm proud to announce that Kentucky will award $500,000 to 85 humanities organizations that have suffered program financial losses due to COVID-19. Kentucky Humanities is an agency in our tourism cabinet, and it's able to provide funding to these 85 organizations. To see the list, visit kentuckyhumanities.org. All right, also today we have some more guidance up. Again, our guidance is to make sure that we're actually giving very specific guidance to different areas of our economy that are reopening so that it can be as safe as it possibly can in the middle of COVID-19. So today we issued guidance on massage therapy and nail salons. And soon we'll be posting cosmetology, hair salons and barber shops, tanning salons, and tattoo parlors. We're also expanding our list of June 1st reopenings. I think I mentioned most of them, but June 1st is also going to include aquatic centers. Now that is what was being posted online apparently when somebody put up quote-unquote swimming today. Stance on pools hasn't changed, can't change right now. But aquatic centers, which are training, we have some Olympic aquatic centers, pools connected when gyms are able to open that are solely lap pools, and pools that are designated for exercise. Those we're going to have guidance on so people can swim laps, people can get that type of exercise. That's very different than a pool that has 100 kids in it that we know, unfortunately, aren't in that position to do social distancing the way that we still need it. In addition, auto dirt track racing will be available on June 1st under some really good proposals that were submitted. Bowling alleys, fitness centers, we already mentioned, and movie theaters. Those are all June 1st. Again, staggering it is the way that all of the health experts have suggested. We're doing it in a way to where hopefully we can build up towards these. We can get people to be very moderate and act in moderation about how many different ones of these that they do on any given day. We're starting at a reduced capacity for almost all of them, but we want to build that up, once we get people in the type of practices that we need to be seeing. All right, so our numbers today are a little bit up, but that's primarily due to the Federal Medical Center, which is a federal prison in Lexington. There have been a lot of cases that are there, a lot of cases with inmates in that facility. And while we are doing our best to work with the facility, we have no control over those individuals which are under the sole jurisdiction of the federal government. Now, we are doing everything we can to test the corrections officers, and we're even providing tests for them to test inmates. So our number of positive tests today is 252. But again, when you look at the overall numbers from that federal prison in Lexington, we do believe that it is still in line with those plateaued numbers that jump, anywhere from 130 to 190. That's pretty much where we are right now, even with significant additional testing. That brings our total number of cases to 7,444. 36 are probable. The others are lab confirmed. That's out of a total number of tests of 127,689. So as you can see, that's about a 6,000 jump from yesterday. We won't have 6,000 every day, but I tell you what, we're seeing more and more testing, which is really positive. Now, that will result in some more positives, but a lower positivity rate, and we believe that we can work through that data so that we know what we're seeing. Total number of Kentuckians ever hospitalized, 1,896, currently 381. Ever in the ICU, 797, currently 218. Number recovered, 2,739. New cases by county. This shows you how much the impact of this federal prison is. Fayette, 66. Jefferson, 44. Warren, 24. Ohio County, 23. We're testing there next week. Shelby County, 12. Davis County, 11. Boone County, 9. 8 in Butler and Kenton. 7 in Muhlenberg. 4 in Allen, Grayson, and McCracken. 3 in Bullitt, Edmondson, Henderson, and Logan. And 2 in Lincoln and Todd. And then 1 in Adair, Campbell, Carter, Grant, Hardin, Henry, Madison, Marshall, Perry, Pike, Scott, and Webster. And today I'm thankful that the new case list has fewer children, though there certainly are some on it. Again, it's just a reminder. I think it's a reminder that we need. It's not to scare anybody. We can breathe and move through it, but just that this is still out there and it affects people of all ages. We have a 4-year-old boy in Jefferson County and a 2-year-old girl in Jefferson County that tested positive, a 5-year-old girl in Bullitt County, a 16-year-old male in Muhlenberg. So again, it's still out there, and we still have to do everything we can to prevent it from spreading. Our total number of deaths today has stayed fairly low, like the last several days. Today we're reporting 4 deaths to the coronavirus. 2 of these were inmates at the federal prison. We are worried that there are going to be more deaths from those inmates. Now, we get their care very late in our hospitals, but I know at UK they are doing everything they can to help these individuals. So these are 4 individuals and 4 families that are going to need our compassion. They are an 80-year-old female from Jefferson, a 74-year-old male from Campbell, and a 66 and a 60-year-old male from Fayette. So let's continue to shine those green lights. Let's continue to add them to every business that reopens. It's just a little something that we can do together to make sure that we are continuing to be there for one another. Our kindness and our compassion are two of the major traits that have us where we are in a positive position to reopen our economy. Let's not stop now. The ethnic and racial breakdown of cases, overall cases, 73.78% white, 14.77% black or African American, and 5.29% multiracial. And then of ethnicity, 86.57% non-Hispanic, 13.43% Hispanic. On deaths, 77.44% white, 19.19% black or African American, 2% Asian, 1.35% multiracial, and then on ethnicity, 97.5% non-Hispanic and 2.5% Hispanic. Long-term care facilities, we show this every single time to be transparent about how tough this virus is in these facilities. 28 new residents, 11 new staff, 2 new deaths, and 1 new facility have been added. All right, testing. So to reopen, to do this safely, requires testing and tracing. And we're going to talk about tracing on Monday. We're going to go through exactly how we're going to do it through the structure. It's going to be an in-depth presentation, but the testing piece is first. And we had a slide that I don't think I got passed along, or did I, about how our testing capacity is ramped up. It's that line graph. And we did get it. Nice job. This is just, it's something that I'm incredibly thankful for. And it's, I mean, I remember the 3rd of April. I remember telling people that if you felt okay, we didn't have enough tests. And that is not the case anymore. Now we have tests for anybody who wants to get a test. I remember standing up here and saying, I want the day. And I really did, where anybody who wants a test can get a test. That's where we are now. If you look at how our total tests have increased and will continue to, this is a story of Kentucky success by Kentuckians, by our labs, by our people who are doing the testing, by our partners that employ Kentuckians. This is one where when we look back, it's one we did on our own to protect us. It's something that I'm very proud of Kentuckians for, and I'm very grateful to everybody who had a part in it. But now moving forward means we got to continue to sign people up for testing. So for the next 2 weeks, we're offering a drive-through testing site to state employees here in Frankfort. We want to get as many of them tested as possible, especially as we open up government buildings. But our Kroger sites next week need Kentuckians to sign up for them. If we can go to the Kroger sign-up slide. Remember, this has been a big boost to our testing capacity. So in Louisville, Monday, we're doing good. But on Tuesday, next week, we have 300 spots. On Wednesday and Thursday and Friday, we have almost 400 slots apiece. So those are a significant number of tests, what about 1,500, that we need the Louisville area to sign up for. Let's make sure you're protected. Let's make sure we're getting the testing we need to know the level of asymptomatic infection, and also making sure that you're not going back to work and spreading it not knowing you are. In Richmond and in Ohio and in Graves County, we need to pick it up. So this is the first time we've been in any of these locations, but we need to pick it up. It's important for your communities. We have about 230 spots in Richmond for next Tuesday. We have 400 spots on Wednesday and on Thursday. So the Richmond area and around it, this is a real opportunity. Let's make sure that you go online and you sign up for those tests. If you go back to how they sign up. Ohio County has pretty much, and Graves County, have 400 tests available Tuesday, Wednesday, and Thursday of next week. These are areas that have been hit really hard. This is a good, safe way to get widespread testing. Now we need the people of Kentucky to step up and get it done, and we need all of our local leaders out there who've worked so hard to get every single one of these slots filled. It's going to make sure that your community is safer, and it is an absolute requirement when we go forward that we have got to fulfill to make sure we are doing things right but when reopening this economy while COVID-19 is still out there. Last piece of news that I want to talk about, and then we'll open it up for questions. Corrections. So we have talked a lot about Green River Correctional Complex, which appears to have stabilized, and we're grateful for that. What we haven't talked about are some of the really good things that a lot of our Kentuckians who are incarcerated, because they are more than inmates, and I know we use that word a lot, are doing during this virus. And they're doing a lot, and I think that needs to be recognized. Our inmates in our state prison have been cooperative in efforts to help stop the spread of the virus first in their own facilities by wearing masks. Most of the time, these are the individuals that do the sanitation. So they have taken control and responsibility for their own environment, and because of that, we haven't seen the same problems that many other states have seen across multiple facilities. Today I got a check in the mail for $5 for the Team Kentucky Fund from one of our incarcerated individuals. He sent a note saying that they watch every day and that their families are out there, and he appreciated what we were doing to try to protect people. I mean, that's a pretty special note to get, and I appreciate his words, which helped lift me up. But I also appreciate that making $5 with the pay scale and the rest isn't necessarily easy for him, and he wanted to share it with other Kentuckians that are struggling. And at Green River Correctional Complex, we had an inmate contact the warden last night who wants to donate to the fund. With everything else going on, these are special acts. North Point Training Center donated cloth masks made by the incarcerated individuals to the United Way. And Kentucky Correctional Industries continues to produce cloth masks that we're handing out all across the Commonwealth, thousands upon thousands of them. They're also making medical-grade gowns for the Department of Corrections and other staff around the Commonwealth. The Kentucky Correctional Institution for Women, in partnership with Paws with a Purpose, are providing cloth masks for Norton Healthcare area hospitals. Norton Foundation supplying their materials. So I want to thank the Department of Corrections staff, but I also want to thank all of those individuals that in this time of need are stepping up and are doing good work. I'd like to think that as individuals we're judged by the totality of our actions, and these are really good actions being done by folks during this period in a number of our institutions. All right, with that, we'll open it up to questions. I think we've got our Cavalier, Ben Tobin, Lawrence Smith, and we've got Joe again, and we have Jess Clark from WFPL. And so, Jess, I think this is your first time with us. Why don't you start us out?
So we talked a little bit about Green River Correctional Facility. Does each separate housing unit have its own guards, or are guards going in between those housing units, for example, in between units with vulnerable people or negative people?
Right. So the question is on Green River and how the staffing is done. We checked on this the other day, and to the maximum extent possible, I mean, this still is a prison institution. They are trying to keep cross-pollination of staff as low as possible. What they are doing is using extensive PPE as well. So just like our medical staff would do going into a COVID wing, and if they had to, going into another. So we feel good about those practices, and one of those practices is to limit the interaction. Now, when you look across our correctional institutions, one of our real challenges are staff. And so I don't want to minimize that, and there are occasions where someone would have to be in different areas. But we are continuing to retest. We are continuing to monitor, especially the vulnerable individuals. And we've been excited that through the retesting, we haven't seen any growth. Right, Michael? No growth at all in the positive tests in the institution. Now, we got to keep that up, and that's something that we're committed to. Question here about timelines for museums and other cultural attractions. We're going to be working on that for June and for early June. We think we've got some very good guidance that's out there that we've worked with other facilities for. We're going to be working to try to get that out as quickly as possible. But each cultural attraction, that's kind of a big term, but let's just say each museum is also going to be a little bit different. There are some that have hands-on experiences, and we can't have those. As the Harlan County Health Department reminded me that I say too much, y'all can't be doing that. So we can't have the different things that people would touch and then other people would come by. And we were actually working in the Kentucky Historical Society because they just have a couple of exhibits like that, which gave us a good background on that. But again, when we can do something safely, we want to be able to do it. Now, 2 outlets asked what type of swimming would be allowed on May 25th. Somebody put that up on the website. They shouldn't have. I apologize for those that saw it and started thinking different things. On June 1st, we're going to be able to have exercise, lap pools open. I know it's an important part of exercise, but that also socially distances. There's got to be lanes in between. And again, that doesn't raise the concern about spread, but it does allow for exercise.
Governor Beshear, in your Healthy at Work order for reopening restaurants, you define a restaurant as an entity that stores, prepares, serves, and vends food directly to the customer, or otherwise produces food for human consumption, including any establishment holding a food service permit in good standing. What I'm wondering is, does a bar that produces food for customers and that holds a food service permit count, and can they reopen alongside restaurants?
So the question is, bars that also serve food or have a food service permit can open along with restaurants, but they've got to act like a restaurant, which mainly includes sit-down types of seating. One thing we want to avoid that can occur in many bars is a crowd that's around the bar. And oh my goodness, if you saw some pictures from Wisconsin after the Supreme Court ruling that struck down all of their mass gatherings, that's the state Supreme Court. That's not the U.S. Supreme Court. It doesn't apply here. What you saw is a lot of people crowded on top of each other. So a bar that has a food permit, spreading people out, again, following all those same rules, can operate. We have some state workers ask us if Healthy at Work rules are supposed to apply to them. So we have specific government guidance that's now up, but that specific government guidance also includes the Healthy at Work rules that we have for other places. We're going to expect the same out of our state employees as we would require from businesses, but remember, different businesses are a little different from each other. That's why we have specific guidance. And that's why we're going to have to work with different parts of government as we go forward. So our clerks, for instance, our circuit clerks on different types of IDs that you go in to get, and we need to work with them on how you reduce the traffic, how much of that can now be done online, because all of us would like to renew our driver's license when we can online instead of having to go in. So we're going to work with them to try to get that done the best way that we can. Lawrence.
Back to the pools issue, clarify you're not talking about public pools, and then
That's right.
talk about where you are on that. There are a lot of people saying that you can limit attendance in these pools, keeping them apart, and this doesn't spread in swimming pools. Talk about that argument.
The June 1st guidance does not apply to public pools. There are those that are saying that this can't spread in public pools. What they mean is it's not spreading in the water, but it spreads if kids are doing playing in the pool. It spreads just as easily there or outside of the pool where they congregate or adults congregate as anywhere else. Again, it's the challenge of social distancing, and in just about every pandemic that we have seen in the past, public pools have closed for this very purpose. So right now, we believe that would cause the spike, as do our public health officials, that would stop us from going back to being healthy at work. Yes, we'd all love for a public pool to open so our kids can go there and play with other kids, but that's the exact thing that spreads the virus and means that we can't do healthy at work. And if we allowed this and it caused a spike and we had to shut down places of work, people would say, well, you didn't do what you should to protect our economy, and we had to pause it again. So this is just a hard but difficult decision, but it's the right decision for now to make sure that we can have our restaurants open at the capacity they start and that they can increase, that we can have our professional services back at 50%, that we can reopen manufacturing. I don't want to shut those down. I don't want to lose the employment that we're looking at bringing back because we weren't willing to make the tough decisions when there was some pressure that was placed. I'll accept that pressure, but my goal is twofold. One, to get our economy up and running to where we don't have to pause it, to where we can be most successful in the long term. And two, I want to do everything I can to be in a position to get our kids back in school in the fall. And those are my major goals, and those are the ones that we're going to make sure that when we make those decisions, that we're making the best decisions to get us to accomplish those two. Are there going to be vehicles or vans coming to senior citizen complexes for testing sites? Our goal is to come to senior citizen complexes, at least where our senior citizens live, to test them. Next week, we are doing thousands of testing in our senior living facilities, our long-term care facilities, and we're going to be doing thousands of more each week after that. Joe.
A group of researchers is kind of putting out this running report ranking states based on their ability to reopen based on the White House's guidelines. Yesterday, Kentucky is one of the only two states that actually appears to be ready, but then revised that today based on how they're calculating the average daily testing. So kind of with that in mind, how would you kind of respond to where Kentucky stands in relation to the White House's guidelines, and especially with testing?
So the question is on a new daily but tracking organization about reopening. 2 days ago, we were one of the only two states that they had ready to reopen. There'd only been one that had ever qualified before. And then we didn't have as many tests yesterday that we reported as the day before. But you know what? We had more today. So I believe that while we moved from their ready to reopen back to the close to reopen, I believe we'll be back in the ready to reopen. I think that it is an indication of Kentuckians' hard work, of the planning and the preparation of our public health and our emergency management work to increase testing. Can you go to the testing sites? It's all the institutions that are doing this that deserve credit too, from the Murray Callaway Hospital to the Pikeville Medical Center to St. Joe's in London, to the Christian County Health Department, to St. Elizabeth's in northern Kentucky. What we have seen is true community across the state that have helped us get there. Now, numbers are going to bounce, and so we may be green one day and yellow the next, which is what they show, but we believe that we are in as good of a position as anybody. But then we're also doing this reopening in the smart way, which is not all at once, but gradually working our way into it. That's both to give us the time to every day hit the testing numbers we need to and have the tracing capacity, but also to make sure that we as citizens, and I hate to say don't overdo it, but we're able to gradually see that what we have isn't an old normal, but a new normal, where even though we can have more contacts, we've got to keep them down lower than we previously did. We were on a call last week where Dr. Birx, from the White House, basically said the new normal, when you reach all the way to new normal, is probably going to be, at best, 50% of what we used to do and the contacts we had until a vaccine or a really effective treatment. We mentioned that the state is in better shape regarding PPE. However, do we still need people to step up and donate? At this point, we would absolutely take donations of a couple things. The N95 masks are still incredibly hard to get, and while the Battelle system, which more people need to sign up for, can help clean those, while we have that machine, we still need more that are out there. Other things, though I think we're making progress, are the medical grade gowns, but we are having much more success on a daily basis, getting to a point where now we're not just providing to facilities when they are at the critical level, but we are already starting to make the purchases to make sure that we are stockpiled, is not the right word, but prepared if and when we have another spike. Jess?
Yes. Schools, the districts got some guidance today from the State Department of Education about what a reopen, what kinds of things
Right.
they need to be considering. But I think what districts would like to know and parents is what are the benchmarks for returning to school? Have you decided, are you comfortable, for example, going back to school with this level of infection?
The question is schools and the fall or maybe even the late summer and what we want to see. This is one that we're tracking really carefully, especially since we have a couple of kids that suffered from pediatric inflammatory, the new COVID-related syndrome. What we're looking for is making sure that we have that it's still plateaued or decreasing with the actual rate of infection. We're decreasing. That we have sufficient testing capacity in every area of the state, that we have made plans to lessen contacts inside of a school too, as we're looking at how we're going to do things differently. We want to see what impact summer has on the virus. Right now, from a scientific perspective, they're not sure it's going to have one, but that's something that we want to see. And what the current thinking is on when and how any fall spike would occur. All of those would hopefully guide us on the right time to start school in a way to get the maximum amount of in-person classes in if we do have to do remote learning for a period of time again. And I will tell you that this is something we're watching every day, and we're getting really good feedback from KDE and from the superintendents on how they can do things. This is an area that I want to be humble, not just to the virus, but also to the experience of our educators and how they can do things. So we're watching all of those. But I want to get our kids back to school, and I hope everybody knows that. I want to get them back to school. We're going to want to make sure it's safe, and we're going to be watching all of these and other things that will arise between now and then, and we're going to have a strong dialogue on a daily, on a weekly basis to make sure it's the right thing. We know that distance learning isn't the same. We know that our kids fall behind when they do it. We know as parents how hard it is to step in and to assist teachers. And now we respect our educators even more. Kroger is suspending hero pay to workers effective Sunday. Can I react to that news? Our grocery store workers have done incredible work. This virus isn't gone. I would love to see that pay increase. Of course, it's additional $2 per hour, so I will tell you I'd love to see that additional pay continue even beyond this. I'd like to think that you ought to be able to support your family working just one job, and it's been a really important job. Second one is quickly, the president now saying that Operation Warp Speed now has a goal to create and distribute a vaccine by the end of 2020. What would I tell Kentuckians about that? Well, normally, it takes longer to create a vaccine, but I'm excited about the news. It doesn't mean that there will be one by that period of time, but this is something that I think the administration is doing right in trying to put as much pressure and as much emphasis and maybe even funding behind getting us a vaccine as soon as possible. That can't hurt. And working with multiple different companies, beginning production early in case that's the one that hits, to make sure we have hundreds of millions of vials and vaccines that are ready. We all want to reach that day, and this is something that I think they're doing right.
Governor Beshear, you've talked a lot about the importance of receiving federal funding. Two-part question for you. Outside of Mitch McConnell, which members of the Kentucky congressional delegation have you spoken to directly? And outside of receiving federal aid, what else do you hope to do as a state to mitigate these revenue losses?
Question is, who outside of Senator McConnell have I talked to directly about the need for funding? We hold a staff-to-staff call, I think, once a week, and I know that's been communicated there. I haven't personally communicated with the other individuals. What I have done is worked with the National Governors Association, which is presenting a united front through its executive director, but Larry Hogan and Andrew Cuomo are our two chairs, one Democrat, one Republican, that are working with the Hill. We get a weekly update on that, and it's not a Democrat or Republican issue, even though that's now how it's being fought in D.C. And I hate hearing we don't want to do this for red states or blue states. I mean, we're all people. We're all Americans, and we're all being hit by this virus. And the recession will be worse everywhere without this type of funding. If they want to debate some of the other funding in that HEROES Act, okay. But without state and local help, our recession will be worse. Those that are marginalized will further fall through the cracks. This is funding we have to have. And again, if the federal government was willing to do it when we had a recession, not doing it in a global pandemic, I believe would be malpractice by our federal government. Okay, I work in a therapy department at an inpatient rehab center. I've been told that if I leave the state, I'm unable to return for 14 days. So first, if it was for work, that's not the case, but the travel ban expires on Friday. So for this individual, it shouldn't be a problem after that day. Go, Lawrence.
On restaurant guidance, the disposable menu, tablecloths, utensils, things like that, is that a suggestion, or are they required to have things like that?
It's about the restaurant guidance. I believe that's mandatory as long as it says must. If it says should, it's optional, but most states that are coming back are requiring those types of things out of restaurants. It's trying to reduce the amount of things that one person touches and then the server takes and then the next person touches after that. I believe our restaurants have taken this seriously. I believe they have submitted really good proposals. I know they're not happy about the 33%, but let's prove that we can do this as we begin to ramp up. I believe that will establish better practices, and consumers want to be confident in the safety of those. So, I think that they're really important requirements, and I think our restaurants are ready to meet them. Joe.
I want to go back to testing, and in regards to the statements about how everyone in Kentucky can get a test if they want one. In relation to benchmarks specifically regarding testing and how many need to hit, how much of a concern is it that there might not be enough people actually signing up for testing or showing up for testing when they do sign up versus just the sheer availability of those tests?
Question is on testing versus the benchmarks we need to hit. We need to ultimately get to a point where we're testing about 2% of our population, so about 88,000 people a month. Right now, I believe that we have the capacity to test up to 4 to 5% of that per month. I'm seeing it come together. The challenge now is going to be to have 88,000 plus people tested each month. It's going to happen in a couple of ways. Number one, part of that is going to be targeted testing. So if we do 3,000 to 6,000, I don't remember what the number was, long-term care facility testing next week, that will go in to what we need to do in the month. When we need to do testing in hospitals that they're going to do before they're doing procedures, which they can now do in phase 3, that's going to go into it. So some of the testing is going to become more natural than it seemed. It's going to become part of longer-term programs done in hospitals as a more regular step. But our goal is to have drive-through testing, testing connected to businesses, because if you're doing a fever check now every day, you're going to have people that you need to send to get tested. Testing connected to nonprofits, to houses of worship. And the better we set up these systems, the closer I think we'll be to it. I believe we can get there, but it's also going to take the public buying in. And all this is going to take the public buying in. Those that are ready for the economy to reopen, great. But the only way to do it, and this is coming from the White House, from the president himself, from the experts they have from our public health, is testing plus tracing. So the only way to do it safely is people got to be willing to test, and then on the tracing, you got to be willing to pick up the phone when your local health department or the state calls, right? When it pops up there and it says public health, and it means that you may have been exposed to somebody, and you know when you see it that you may have to self-quarantine, you got to be willing to pick it up, and you got to be willing to talk to the health officials. If you tested positive, you got to be willing to tell them who you've been around. That's the only way this works. So it's a new test of citizenship. It's that new test of humanity, of making sure that we do what it takes. We'll do one more question for everybody.
Sure. You're opening campgrounds. So you all had to close those because people weren't social distancing before. What makes you think that people are going to do that now?
So the question is, if people weren't social distancing at campgrounds before, what makes us think that they'll do it now? Well, we've had a lot more cases of the coronavirus since then. People have seen how serious that it is. This was when we were escalating and on the way up. I believe that it's become part of our daily routine to social distance. And while people might not while the rules will change, hopefully it's become, over the last couple months, just a part of our daily lives, and it will need to be. Again, until we have the vaccine or the proven treatment. So I think we've had a lot of practice on how to do it right, and people have seen something go away, right, that they wanted to do because we weren't doing it right. And so I think we also see a lot of positive social pressure on what needs to be done, and that's important. You know, so if you've got a couple of folks that are at a campground that aren't doing it and everybody else is, you need to very nicely say something. And again, it's got to be nice because everybody is on pins and needles and anxious. And it doesn't need to cause confrontation, but it does need to say, please follow these rules so we can all be healthy and so you don't mess this up for everybody else. That's the way I'd say it. Ben.
Maybe like 3 weeks ago or so, you were asked about Kentucky Kingdom and their potential plan to reopen. I was just wondering if you could give an update as far as your communication to the amusement park and thoughts on amusement parks reopening in general.
So the questions on Kentucky Kingdom, amusement parks at best would be a phase 3, which right now is looking in July. I believe our Commissioner of Public Health is reviewing that proposal. But at the end of the day, we can't make our decisions based on economic hardships. We got to make our decisions based on public health and keeping this virus down so we can keep reopening our economy. If we were Philadelphia, can you show the slide just so we can? If we are Philadelphia and we do something similar to that giant parade, we spike our cases and the whole economy shuts down again. So, as we look at things like county fairs, that's kind of on the county level. On the county level, unless we can figure out a way to do it really safely and differently, and we're willing to listen to that. But on a county level might be that big parade from Philadelphia. And so one thing we've got to look at, and local officials have to look at, is it worth doing one of these if you have to shut down every local business that opened? Because that's the balancing act we're playing, right? Is how much we reopen for contacts versus if the contacts spread the virus too much, do we then have to close down what we opened up? And so we need people to be thoughtful. This thing can't just be a don't reopen anything or a reopen everything, right? And the fact that I hear some folks on either side that have concerns means that I think that we're generally doing this right. There's not an absolute best answer, and the best answer certainly isn't fully one way or the other. It's about finding that right lane where we are protecting lives, where we're restarting our economy, and we're not doing things that would cause this and thus shut everything else down. In many ways, it's moderation, right? It's moderation that's going to allow us to stay open, to continue to rebuild our economies. And I said this the other day, in the coming weeks, I think we ought to start having a real conversation about how we want to build the future of Kentucky's economy. Everybody is going to be in a place where much of what's going to happen isn't just a rebuild, but a building itself, and building a more resilient and a more strategic economy is a real opportunity that we're going to have. Lawrence.
On reopening, states that have reopened more quickly are not, at least so far, seeing a big spike. In fact, it was reported yesterday by CNN that Georgia's number of cases has declined. Does that influence your thinking at all?
The question is on some states that have reopened haven't seen overall as a state an increase yet. And first of all, I'm glad anywhere there's not more COVID cases. We look and we compare ourselves to other states, and I'm proud of what we've done, and I think it compares well against anybody. But I also don't want any other state to have a whole lot of COVID cases or more than us. As we have looked at other things that we can reopen and the timing, certainly the experience we're seeing in other states we take into account, but it has only been 2 weeks. And so the concept that if somebody opened 2 weeks ago and there's not a spike, that would mean that the virus all spread on the first day of the reopening, or maybe the second day. And so we want to see all of it, but we are taking that gradual steps, typically in many areas just a couple weeks or a week behind many states that are close to us. But we're going to keep watching that. And if other states are able to do some things successfully that we're not doing right now, yeah, we'll take a look at that. Again, we're not trying to restrict things just to restrict them. We're just trying to do this right to protect people's lives while restarting our economy. It's got to be a balance of both. All right, Joe, take us home.
When we were starting all of the drive for testing, I remember you saying that there was an issue with people just not showing up for scheduled appointments. Are we still seeing that now with these facilities?
So the question is, are we having more no-shows or no-shows at our drive-through facilities? We are, but we're also scheduling more people. So we are getting more efficient at what we're doing. But yes, I would like to see anybody who signs up to actually show up and get that test done. I may be able to, I'm looking through here, give you an idea. So it looks like this week, as of 4 p.m. today, the 4 Kroger sites have done 5,736 tests. We could probably, we did pretty well during the week. In most of the places, we could have probably done 200 more. So this has been a better week about it. But yes, we need to make sure, when we looked at Shawnee and Louisville, they only had 365 on Wednesday. That ought to be 400. And when we look at Corbin on Wednesday, 303. That ought to be 400. But still, 303 tests in a day is a lot better than we were as we looked at that graph a while ago. So I was asked the other day on a radio show what I felt good about, and my job is to worry, is to make the right decisions, but I worry every day about every family out there. And I said I don't feel good about anything. That's not right. That's not accurate. That was my attempt to convey that we all need to worry when we go out. That doesn't mean we don't go out. But if we worry a little bit about it, then we think about how we do things safely. We think more about our actions. But I feel good about our testing. I really do. Now, we got to do more, but we're on the right trajectory. And it was always capacity that was the true limit. And when your capacity is the limit, you can't get where you need to go. So now we know we can get where we need to go. We just got to develop the strategies, which I think we have, but we'll need, I'm sure, as time rolls on, we'll need to change them to make sure that people are getting tested. Oh, I don't know if they got tested last month. Maybe go in and get tested again. And so that's going to be where we turn. But for us not to be at a place where we don't have enough tests, and now we have enough tests, we just need to get people tested. I feel pretty good about our ability to meet that challenge. On Monday, you're going to see our contact tracing, and while it is a big endeavor, I feel good about the leadership we're going to introduce you to on Monday for it. I feel good, though it's going to take some time, about our ability to integrate with our local health departments. We're all on the same team, and it's just going to take making sure that everybody knows that this is a support role that we're going to provide to them. I feel good that we have plateaued in cases, but we still have a lot of work to do. We're going to have more contacts than we've had, and we got to make sure people stay safe. So let me mention as we close that a week from today, People are going to be able to meet in groups of 10 or less. That's something that we have all waited for, and I am really excited. But let's spend the time between now and then thinking about how we're going to do it and how to do it safely. This is our lives for the next at least several months. And thinking about things that we can now do that we used to do, how we're going to do them differently so we can do them safely and so that we can continue to do them. So let's continue to be those good Kentuckians we've been. Let's continue to do things right. And more and more every day, let's wear one of these. I know I hear people that said, I saw a quote that said, well, it's my liberty, it's my life. It's your life, but if you don't wear one of these, you can impact somebody else's life. And at what point do we have to take responsibility that we're in a pandemic where our refusal to do something like this could cause someone else to lose their life? It'd be different if it was just that individual that doesn't want to wear one, but it's that your actions hurt other people. And I'd like to think we all have a different frame of mind of that. To me, it comes down to faith, loving my neighbor as myself, and I feel confident that in my faith and in the teachings that I'd be expected and I'd want to wear one of these to protect other people around us. So we got a treat as we end. This is this special green lights that people are lighting up all across Kentucky. Symbol of compassion, lets people know that we're there for them. It's also a symbol of our unity, so I hope you enjoy. Tomorrow, we'll put out a video that'll give people the overall numbers. We won't make other announcements. No press conference on Sunday, so folks enjoy. Keep following the rules, but turn some of this off. We can't live it every minute and every hour. Enjoy your family. Find some joy out there. Just because we feel a little cooped up doesn't mean that we can't truly enjoy some of these quieter moments. I will see you Monday at 5.